Hello, my name is Dr. James Rore. I'm a dentist that has served the Stockton, Lodi, Linden area for the last 30 years. We are a highly trained general dentistry practice, and we offer advanced care such as IV sedation and implant services. I'm a graduate of UOP and UOP Dental School. My sedation training was at USC. I'm a credentialed member of the American Academy of Implant Dentistry. Today, we would like to talk about sedation. We use sedation to help the fearful patient or the patient that has difficulty in getting numb. There are several types of sedation that we use. First is nitrous oxide. Nitrous oxide is inhaled. It's fairly easy to administer, and we use it primarily for pediatric patients. Sometimes we find with adults it's not adequate to achieve the level of anesthesia that we need. And another advantage of using it is a patient can leave without feeling sedated. Another common method of providing sedation is to use a pill. Now, the disadvantage of using a pill is it's difficult to get just the right amount for an individual on an individual day. It takes about a half an hour for the pill to work, so we're guessing at the level of anesthesia. And we tend to not sedate very heavily because of that, just in the interest of safety. The best method in most cases is to use an IV. The advantage of an IV is we can use just the right amount of anesthesia necessary, and in most cases, patients will sleep through the procedure. At this point, I would like to demonstrate a case for you. We're going to administer medication to you via a continuously running IV. So throughout the procedure, we can add medication as needed to keep you comfortable and asleep. Are you comfortable with that?
Great.
Okay.
Sounds good.
All right. Let's get started. Dr. Dickey, I've started the medication for you. You're probably starting to feel a little bit drowsy. This is my last opportunity to talk to you before I put you to sleep here and let you take a little nap for us. A couple of things I wanted to point out. We do monitor our patients. We monitor their pulse and their pulse oximetry, which is the amount of oxygen in their blood. So if for some reason he started to oversedate a little bit or was starting to have a problem, the machine will let us know that his oxygen level is dropping a little bit, and we can take steps to bring it back. Dr. Dickey, are you with us here?
Yep.
Kind of. Okay. Dr. Dickey, do you know what this is?
$20 bill.
A $20 bill. That's correct. And if you can tell me what this is at the end of the procedure that we showed you here, then I'm going to let you have it. Okay? You'll get to keep it. So do your best to remember that. Okay. Now we're going to go ahead and proceed with your procedure. Okay? I just wanted to say that we will run a line, and I can continuously administer medication for Dr. Dickey, but he doesn't have to continuously be stuck by a needle. Dr. Dickey, take a deep breath for me. Take a deep breath. And you can see that when we need to, a little tap on the shoulder and we can wake him right up. That's the level we like to keep our patients at. There you go. Perfect.
Okay.
How do you feel, Brad?
Fine.
Good. Did you have a nice little rest?
No, no pain.
Good. You know, I showed you something before we started. Do you remember what that was?
No.
No?
No idea.
Something about a president?
No.
No? Okay. I just wanted to make the point that Dr. Dickey had been through this procedure once before, and being unable to get numb, it was a very painful experience for him. So I'm pleased that we were able to give him a pain-free, anxiety-free experience and still accomplish the dental treatment that he needed. I just wanted to make the point also that we showed him the $20 bill prior to his going to sleep, and asked him to remember it. As we all saw, he was not able to remember it, which means I get to keep the $20 bill. And but the nice part is the medications that we use have a very strong amnesic effect. So our patient won't remember the procedure at all, which is comforting. Hi, Lauren. How are you doing today?
I'm good. How are you?
Excellent.
Good.
So you're here for a little procedure, a little dental procedure, and we're going to be removing some wisdom teeth. You've decided to go to sleep for the procedure, which I think for this particular procedure is probably a good idea. Why did you decide to go to sleep?
Well, I haven't been to the dentist in quite a few years, and the procedure itself kind of
Scares you?
me,
Okay.
startles me a little bit. So rather than to be awake and have everybody in my face and it just freaked me out a little bit more, I'd rather be asleep for it.
Okay, all right, very good. Well, we are going to do that for you. Okay, so we'll go ahead and start administering some medication. So just a little bit about the medicine that we're going to use. We'll be running a line through the whole procedure, so I can add medicine as I need to keep you asleep. And I don't have to continually poke you with a needle. Okay, we just have to do that one time.
Okay.
We'll be monitoring you with state-of-the-art Criticare equipment. Lauren, I have a question for you, okay? This is, do you know what this is? It's $20, huh? I want you to remember what I just showed you, okay? And at the end of the procedure, if you can tell me what I showed you, you get to keep the $20, okay? Okay, she can bite on some moist gauze.
Is the tooth already yanked out?
Yes, the teeth are out.
That was so fast.
It seems that way, huh? Yeah. Now, I have a question for you, okay? I showed you something before we started. Do you remember what it was?
Yeah.
When we talked about something before we started the procedure?
Yeah.
No? You feel comfortable? You don't feel any pain or anything?
No.
Okay, well, I just want to thank you very much for allowing us to film you. How do you feel right now?
Coming off of
You feel comfortable? You don't feel any pain or anything?
no.
Okay.
I'm just a little loopy.
A little loopy, yeah, that's the medicine. Okay, and that'll all pass here in the next 15 or 20 minutes, okay? But other than that, you'll be just fine. And I thank you very much.